The proper treatment makes all the difference in helping people with either generalized anxiety disorder, GAD, or post-traumatic stress disorder, PTSD. What are the treatment options for anxiety? Some forms of anxiety can be treated or have their symptoms reduced by only treatment. Psychotherapy, or psychological counseling, is an effective treatment for anxiety. Cognitive behavioral therapy relies on teaching specific coping skills that can reduce anxiety and manage the onset of anxiety. In instances where there is a biological or genetic component that causes the anxiety to interfere with daily tasks, potentially leading to depression or other depressive disorders, medications can be helpful. Antidepressants and anti-anxiety medications can help resolve some issues with malfunctioning neurotransmitters, potentially reducing symptoms of anxiety disorders. In some circumstances, a doctor may prescribe other medications like sedatives, which can provide short-term relief for anxiety. A doctor will likely recommend lifestyle changes to reduce anxiety, such as developing a regular exercise routine, avoiding alcohol and substance abuse, stress management techniques, and dietary changes. What are the treatment options for post-traumatic stress disorder, PTSD? PTSD treatment usually relies on medication, therapy, and self-care to address mental health concerns. As with generalized anxiety disorder, cognitive behavioral therapy is quite effective at treating PTSD. It helps the affected person focus on the relationships among their thoughts, feelings, and behaviors, as well as attempting to change behavioral patterns causing symptoms such as difficulty concentrating. Cognitive processing therapy is a sub-practice of cognitive behavioral therapy. It helps patients learn how to modify their thoughts and unhelpful ideas that could be causing the affected person undue stress. Prolonged exposure helps those affected with PTSD to revisit and gradually accept dormant memories and situations that may be causing them distress. In addition, facing these fears can help the person reduce stress and anxiety when pressed with unpleasant memories. The relationship between the therapist and the patient is significant regardless of the conditioning used. The suffering individual must trust their therapist for the best chance of recovering from or at least reducing the effects of PTSD. Certain medications also offer positive effects in PTSD cases. For example, selective serotonin reuptake inhibitors, SSRI, are sometimes used selectively and on a case-by-case basis. The duration of medication and the dosage are significant to ensuring the best results. For those suffering from major depressive disorder and PTSD, venlafaxine is often prescribed daily to balance serotonin neurotransmission, providing benefits to those experiencing PTSD. Each of these treatment options potentially have obvious adverse effects, though they are helpful. Nevertheless, the tools in the link below can be an addition to your toolkit for a better health. Click the link below for details.